Welcome back again to my YouTube channel, Garden of Fertility. I believe we have a wonderful time yesterday on live video. So you are privileged to be part of this live section today. You are privileged. Yes. I celebrate you all my new subscribers, my regular viewers, my intending viewers. I also celebrate you all. We are here for just one common goal: to create solution to infertility. It has caused a very big havoc and wreck in our society today. It has caused a lot of depression. A lot of homes have been battered, shattered, ruptured, damaged beyond repairable. Have caused a lot of threats, fights, making a two family not to be in good terms, to become a worst enemy. But we are here trying our best to bring the possible remedies to overcome this, especially couples who have been waiting for years. But before I proceed, I'd like to introduce myself again for my new subscribers. My name is Opera Stella Telma. I'm a medical lab scientist by profession and also a fertility counselor. So for those of you that don't know me before, our aim and objective of having this channel is to tackle the menace of infertility in our society, and also to educate people more on fertility education. Not just fertility education, to know more about your reproductive health. Many a times when sickness comes like this, it must give you a symptom. There must be a symptom, there must be a sign before any sickness comes up. So, symptoms you may see in your body that you can't take for granted. There are symptoms you need to see in your body, you need medical attention. So all these things we want to bring to your notice to give you the proper orientation, because ignorance to medical attention can be very costly. Something that can be prevented on time, you see at the end it will become difficult, and it will now come to the extent, assuming you were here before, assuming you came last 2 years, assume this thing could have been tackled, this thing could have been managed. There could have been a way out after all the wasted and all the delays. So this morning, I want to quickly talk about infertile couples. Infertile couples. We have two types of infertility. But by the way, what is infertility? Infertility is the process by which a woman and a man that stays together in a house, they have regular sexual intercourse without protection. A man and a woman that stays together, and at the end, they cannot be able to produce, they cannot be able to conceive. Why is it so? If a couple is fertile, they can produce. 1 month, 2 months, 3 months, it will enter if of them are okay. But in a situation that I've tried for years and still there is no possible result coming out, that means something is wrong. Many people have stayed in this condition for so long. Many people have been delayed in this condition because they keep on gazing. They keep on gazing that they have, some people say, it's like I have, you don't gaze when it comes to issue of fertility. You don't gaze. You must be accurate. You must be sure of what you are passing through. You must know the root cause of your problem and know the things you need to avoid. Now, we have two types of infertility. We have primary, we have secondary infertility. In primary infertility, this is a situation where a woman have never conceived for the first time. Why secondary infertility? The woman have conceived before, but she's finding it difficult to get pregnant again. So we are going to take this one by one. In primary infertility, this is a situation where a man, it is a situation, it can come from the man or from the woman. So infertility in man can result as a result of a man inability to pregnant a fertile woman. In this situation, the woman will be fertile, but the man is having the challenge. While in women, infertility in women is that inability for an infertile woman to conceive. This infertility we are talking, it doesn't happen. Sometimes it's not as a result of a birth. Sometimes when you get your reproductive age, there are some development, there are some things that may happen as a result of what we eat or what we do, or our routine and regular lifestyle modification that can cause all this problem. Yes, that can cause these issues. There are some things we eat. We don't know that all those things are affecting our health. There are some things we love doing that have caused more harm than good to our body. Now, how can we overcome this primary infertility? Primary infertility can be overcome, first of all, by going to the rightful diagnosis. You need to know what is the root cause of the problem. What are you passing through? What is causing this challenge? Now, when you know the root cause, what are the possible remedies? What is the right prognosis to overcome this menace? Yeah, that is what will come to your mind. And in this diagnostic process, the man and the woman need to be involved. In a situation where a man or a woman have STD, sexual transmitted infection or disease, and you are treating only the man, the tendency that if the woman or the man, if both of them have sexual intercourse again, the tendency that the sickness will come back is there. So when you are treating a man or a woman for sexual transmitted disease, this procedure must be done in both of them, both the man and the woman. Now you have known the root cause of a problem. What are the possible remedies? What is the better option? Are you getting the right information? Now, they said you have a fibroid and you keep on taking herbal drugs from one place to another. Let me tell you the truth about this fibroid. Some women can conceive with fibroid. Some women cannot conceive with fibroid. So I encourage you, if you have tried and it's not working out, please, there are other methods. There is plan B. I don't encourage anyone watching me today to go and be taking herbal drugs. There is a growth. There is extent a fibroid growth will go. All you need is surgery. And after the surgery, you can maintain your body weight. You can take other anti-inflammatory drugs or supplements that can make the hormone like estrogen to be on a minimal level. Because whenever estrogen, that is estradiol, is high, the tendency that the growth will be proceeding. So all these things, you need to be taking it to maintain your body weight, so that even if you have regrowth, it will take time, it will take years for that regrowth to come back. And another thing I also tell women that are passing through this fibroid issue, you have to meet a gynecologist, a specialist, not just a gynecologist, but a specialist. Because when a specialist do you a surgery, he will remove even the smaller ones there. Even the ones that are still remaining, he will remove all of them before it will regrow. Before it will regrow, it will take time. Some people have been deceived that if you do private, yes, it will regrow, but it will take time. The one that have grown already, do you know how many years it takes to get to that level? Do you know how many years it takes to grow to that extent? Which, you know, if you control your intake, things that can make the estrogen, the hormones, to be very high, if you can control it. After the surgery, you take your time to maintain your body weight and also curtail what you eat, too much carbohydrate, and the rest of them. At least before 3-4 years, you will give birth and still go back. If possible, you do IVF. You can give birth to 4-5 at a go and rest. If you are having if there is panic, if you're having the panic that the fibroid will regrow again, why not go for IVF? At least you can give birth twice, twins 2 times, and you rest. By the grace of God, God will help you to achieve that purpose, to achieve that aim. God will help you to do what? Achieve it. So now the root cause is the problem. Some people have endometriosis, some people have PCOS, polycystic ovarian syndrome. You have tried so many, you have tried. Why can't you look for alternative? Why can't you look for another method? That is why your fertility counselor is here. That is why your fertility counselor is here. To give the rightful option so that you can choose. But when you keep on guessing, they said, and they said this one will do this one. They said, who is telling you, who is deceiving you, who is telling you that thing? The more you keep on saying, they said, time keep on going. Yes, time keep on going. Something you can do and believe God, you see it working out. Other people have done it, it's still working, and it's still to keep on working till tomorrow. So that is the fact. Find out the root cause of the problem, get the rightful information, and what next to do to overcome this menace. It is possible. It is treatable when you know the root cause of the problem. Number two is secondary infertility. This is a situation where a woman have conceived before, but she is finding it difficult to take in the second time. She's finding it difficult to take in the second time. What can lead to all those things? Many a times it can come as a result of error. Maybe previous pregnancy came with CS. And during that CS, there is a complication. Or some who have added weight, more weight. On the process of added weight, their hormones will be high. Some can be as a result of infection. Some can be as a result of growth. So all these things you have to find out. This secondary infertility mainly comes more on the men folk, on the men's side. You see the man will start getting weak as a result of stress, the type of work he is doing. Or you can see a man that is smoking or that consumes excess alcohol. You see the man having the challenge of low sperm count or weak erection. How can you tackle all these things? You cannot say, I am waiting. You keep on waiting. What are you waiting for? How will that thing happen? You must be doing something. You must be doing something. So, this secondary and primary infertility are treatable, are curable when you give yourself attention. When you give yourself what? Attention. When you give your health attention. So that is it. You have to give yourself attention and care more about yourself. Hello, one of our clients. Hello, I'm on live section now, please. I'll call you back. Hello. So that is it. We keep on holding. We have many of our clients waiting outside there, so we have to attend many of them this morning. But I said before I start attending to them, I want to talk to you. I want to talk with my viewers online this morning to tell them more things and the things they need to avoid. There are some things that lead to this infertility in men. Number one, stress and anxiety. Anything that can cause anxiety. Yesterday, I talked about emotional stress, emotional disease. It can affect your fertility. Avoid it at all costs. Mood swing, sexual transmitted disease, and many things that can lead to this challenge. We also have men that take excess alcohol, men that smokes. Accidental injuries can also lead to this infertility in men. There are many other things. People that have twisted blood vessels. Some people, they have twisted blood vessels. And this twisted blood vessel affects the flow of blood to the penis. Some people have heat, and maybe as a result of where they work, the environment where they work, the kind of chemical they use in their place of work, all these things lead to infertility in men. And also some have descended testicles, some have low sperm count, some have testicular cancer, and many more of them. People that take excess sugar. Excess sugar, diabetes can cause weak erection. Diabetes can cause weak erection. So you have to avoid it at all costs. Your intake matters a lot. Your intake matters a lot. Your intake matters a lot. So, because this issue of infertility is one of the major problems facing humanity today. I thank God for SDG, for their vision in facing this challenge of infertility, helping the society in the modern fertility, all these reproductive assistants that have provided, helping people for them to overcome this issue. So now we are going to be talking about the things that can cause this infertility in women. I said about the men's side. I'm going to talk about the women. One, lack of ovulation. Some women don't ovulate. Some women don't ovulate at all. And they don't know. Some people don't know that they don't ovulate. I want to tell young ladies here watching me today, young ladies watching me outside there, once in a while you go out and check yourself. Check your body very well, yes. Check yourself, know your fertility, know it very well. I said know it so that you can, some people are there, they don't know their blood group, they don't know their genotype. They don't know it. They don't know it. So when a man comes to them now, they will be running around. They said. You have to know your medical history. As a man, as a woman, you have to know your medical history so that it can be easy for you. If it's something you can start handling at your level, at your reach, you can start on time. Know it. Know the possible remedy on time. So that when you enter into your marriage, you can know possible means on how to overcome this. You know you are passing, you have fibroid already, you know. And you are looking for a man to go for surgery, yes. But this one, you don't know you have it. You don't even know. When you enter into, you start being surprised over everything. Start getting depressed. No. You have to find out all those things. You have to know it, yeah. You have to know it. As a young man, as a young woman, check yourself. Go for proper check. Once in a while, you go for scan, uterine scan. To know how your system look like. To know how your body look like. What is inside there? What is inside your body? Is your system in order? If you find out it's not in order, you start on time. If it's something you will take hormonal drugs, you do. If it's infection, you treat yourself very well. And when you treat yourself, you repeat the same procedure again, the same test again, to know whether you have come back to your normal state. Likewise, the men folk. You check your sperm count, you check your sperm morphology, your sperm motility, the movement of your sperm, whether they are moving rightly, they are moving in the rightful direction. Some persons ejaculate, but they don't know they have azoospermia. They don't have sperm cell. If you watch my previous video where I differentiate the difference between semen and sperm cells. Some people mistake it as in sperm cell, they move. You can only see it through microscope. You cannot see it with physical eye. But semen are watering. That the fluid may be coming out, but the sperm cells are not there. So how will you know all these things without going for a proper check, please? I encourage everybody down there. I encourage everybody to keep on doing the right thing. Know your fertility. Even your children, encourage them. Encourage them to avoid some future circumstances. Yes, to avoid some future circumstances. So, I mentioned lack of ovulation. Some women that don't ovulate, and they don't know that they don't ovulate. So, women that are having cysts, endometriosis, polycystic ovarian syndrome, but they don't know all these things. There is need for you to go a hormonal profile test to know whether your hormones are balanced. To know whether your hormone is balanced. So there are some other things that can like some women that don't have womb. Maybe as a result of surgery. The surgery costs the loss of their womb. But miracle can still happen. I've seen somebody, they removed her womb, everything, but she still put to bed. But the child was kept in a pouch. How that pouch came there is only God that knows how the pouch appeared. So that is it. Some persons have damaged fallopian tube. Some people, their two tubes are blocked. Some people, one is blocked. What is the cause of this blocked fallopian tube? This blocked fallopian tube can be as a result of untreated sexual transmitted disease. There are some sexual transmitted disease that can be in the body without showing any symptoms. You won't know, but it's there. For example, gonorrhea, chlamydia, they can stay in your body for so long without you knowing. They can stay in the body. damaging things, causing scare in the tubes. But how will you know? How will you know if you didn't go for a check? So I encourage all of us today, please. If you're a woman outside there, please, once in a while, if you see any symptom, even on your leisure, once in a year, go and check your body. Go and check your system. Know what is happening there. Know how it's functioning. Don't take any sign, any symptom for granted in your body. And another thing, some people have pelvic inflammatory disease. As a result of sexual transmitted disease. As a result of sexually transmitted sexual intercourse. You need to avoid at all costs multiple sexual partner, please. For our own good, for your own good. Multiple sexual partners. So that you can easily trace where your problem is coming from. You can have more than 4 boyfriends at a time. But you cannot differentiate the one that gave you the STD, the sexual transmitted disease. But when you have one person, or rather you abstain yourself, when you have one person, you know this is the only person I have. And here is where I contacted, and he may have the same similar sickness and symptoms with me. So you can easily trace it and treat yourself. But when you have multiple partners, you don't know whether it's Mr. A or Mr. B or Mr. C that have this infection. Where you contacted the infection, you don't know. So that's why you need to be very careful. You need to be very careful, especially women in their reproductive age. You need to be very, very careful. You need to be very, very careful. And also some people have cervical mucus. Cervical mucus. All these things can also cause infertility in women. Some women have inhibited sexual desire. They don't have urge. Even if you touch them, even if you touch their breast, trust their body, caress their body anyhow, even if you're naked, they don't have that feeling. They have low libido. With subsequent time, as time goes on, there are some things I will encourage you to start taking as a man, as a woman, so that you can be able to be having urge. Not just having urge, you will have feelings for your partners. For couples, yes. I will introduce it. It has been working. And I told us before now that this channel, we don't really sell drugs. But anyone we see that is working, I personally will come out and advertise it. I will test it. I will use it. I will also give other people to use it. If it is working, I will come out here and encourage people, advertise it, tell you to buy it. You will not regret it. So there is one tested and trusted product we have for especially women, husband and wife, couples that are having low libido. They don't have libido. They don't enjoy themselves. Or women that have dryness. They're always dry. They're always dry. So that their body, their pussy can be watering, so that they can enjoy themselves. It can also help the sperm to swim fast to fertilize the egg. So all these things, couples need it. So that is what we are saying. Now, we have some women that have gastric dysfunction. Maybe as a result of what they know or what they thought. They have this orientation that sexual intercourse is this, is that, is painful, is this. To convince them is not easy. Even as their husband, you to convince them is not here. It takes time, it takes patience. So I encourage men also, you need to monitor your partner. Likewise, the women, you need to monitor your partner, know their weakness, know their weak point. You know how to help them. Yes. When you know their weakness, you know the point, you know the area, you will do what? You will come in and help them. And also again, Want to use this channel to encourage couples when you're passing fertility issue. It's not what you will use. It's not an avenue you will use to be exposing yourselves. This is the time of prayer. This is time to encourage one another. This is time to build your faith. It's time to build your faith. It's not time to lay complaint or blame one another or say you are the cause of the problem. I've seen a couple, they keep on blaming each other. This one say when you were young, you have been flattering, you have been doing a series of abortion, you have been doing this, doing that. No, 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 no. It's not encouraged. If you love that woman, if you really love that man, you have to help her. You have to help him. That is why God brought you people together. There is no coincidence in that journey. There is a purpose. Every marriage have an assignment. You have to discover your own assignment. The reason why you are in that man's life, the reason why you are in that woman's life. You have to discover it and start discharging it. Two imperfect people that comes together. You work it out. You must work it out. That's why I say you don't keep on saying, I am waiting, I am waiting, I am waiting. Waiting, yes, you're waiting. But you must be doing something. What are you doing in that you're waiting to make your evidence to come up? To make your evidence to manifest? Because what people are waiting for is your result. Nobody's interested in your stories. So meet a fertility counselor today. We are here. I am me personally. Opera Stella Thelma is here for you. In the comment section, you can chat me on WhatsApp. Immediately I see your text, I must reply you there. If you have a result, a medical result, you don't understand, you don't know how, bring it, scan it for me, send it on WhatsApp, I will explain it to you. I will explain the result for you and what the result means, yes. And tell you possible remedy how you need to overcome that. By the help of God. By the help of God. For now, we do online counseling, we do online consultation too. For those of you that are not in our location, yes. For those of you that are not in our location, so get your time, visit your fertility counselor for proper counseling, for proper guide, for you to make a rightful choice. Infertility is treatable, it is curable. It is what? Treatable, it is curable. So you have to give me some time. I want to see some of our clients that are waiting, people that are waiting for me urgently. I am coming back. I'm coming back. Please don't go off. Don't go off the line. Just give me 5 minutes. I'm coming back. I'm coming back to you. Okay? I'm coming back. So welcome back once again. Welcome back, all my viewers. Welcome back. Welcome back. Welcome back. I have a lot of my clients that are waiting outside there for consultation. So as they are waiting, I have to also round up with my live section. But before we shut down, there are some little points I want to pinpoint. I want to say before we go off this morning. Now, there are some female infertility therapies, and there are some method for treating female infertility. I will mention few here. Now, when somebody is being diagnosed of sexual transmitted disease, mainly you need to take antibiotics. You need to be placed under antibiotics to handle that fertility challenge. You need to be placed under antibiotics to overcome that issue. Now, there are some treatment options. We have conventional method and we have natural therapies. Yes. In a situation where a woman or a man need to change his lifestyle modification, like people that love taking alcohol, people that consume much tobacco, smoking, and the rest of them. Those lifestyle need to be changed, need to be stopped for you to get a proper result on what you are looking for. So, like people that have short menstrual cycle, there's some women that have short menstrual cycle, but have not been able to track exact days, their fertile days. Yeah. You need to monitor your cycle. You need to, I said it before, you need to monitor your body system, monitor it and how it operates, know it on your own. There are some things doctor cannot do for you. Yes. There are some things doctors can't do for you. You have to do it yourself. You have to do it yourself. You have to know it. You have to track it yourself. Know your fertile days. Know your free period. Know the right time you need to meet your husband. Some people have a short cycle. Some women have a long cycle. Now, subsequent time, we are going to teach you people how to track all these things. How to know your cycle. And there are some other people that need to take hormonal drugs. Those that have hormonal imbalance. They need to take hormonal drugs to correct it. And there are many other things. There are some people that need to go for minor surgery. You need to go for a minor surgery. And when you go for the minor surgery from there, you need to be monitored from there till you conceive. So all these things we do is some people have blocked fallopian tubes, and we encourage people that have this fallopian tube. If you have two blocked fallopian tube, we encourage you, if you have tried for years, it's not working out, we encourage you to go for IVF. But when your fallopian tube one is blocked, you can use one. You can use one to take in. It can be monitored through scan. When the egg is coming out from the one that is open, you can use it to fertilize. Your egg can be monitored through ultrasound. Now, you can now use the one that is open to conceive. So, in situation like this, you need to know all these things. And also have it at the back of your mind. Avoid illicit drugs. Eat rightfully. Eat the rightful diet. Avoid too much carbohydrate and sugary things. Sugar intake, please. Avoid it at all costs. And also prevent, I said it before, avoid multiple sexual partners. to avoid sexual transmitted disease. Sexual transmitted disease. It can cause more harm than good. Avoid heavy and frequent alcohol. Adopt a personal hygiene, healthy life, healthy practice, Practice it. Monitor what you eat. Monitor what you eat. Monitor what you eat till you get your results. There are some people on the process of within 2 months of maintaining their diet, you see them conceiving. There are some people that have been booked for IVF. On the process, their system, their hormone get corrected. Everything get corrected and they took in. So you can't tell me you are looking for a child. Every day you keep on consuming alcohol. You smoke, you are a chain smoker. It can't work. It can't work, please. And I sometimes I get angry about the men outside there. There are some men that are suffering their wife unnecessarily. These women have done everything possible. But the man insisted that they can't go for any diagnosis. And when that woman gets to menopause, he will go and marry another wife. My dear, I pray today that God will touch your mind. You watching me outside there. Don't keep that woman in waiting. You can help her. You can help her. You know you don't have sperm cell. You know very well. And you are still keeping that woman there. The woman is okay. You know there are other alternatives you can use to get your results. And you still prolonging. And when that woman enters menopause, you keep on blaming that she's the cause. At the end, you go and marry another wife. Maybe on that one, you go and do IVF or do any mago. The one can go outside and get pregnant. It doesn't work that way. If you really love that woman, if you really love her, you will help her. You will help her. No man, no woman will be happy that he don't have an issue. Nobody. No man will be happy. No woman will be happy that he don't have an issue. He does not have a child. So please, I encourage couple men, make it easy for your wife. Make it easy for your wife. The one I don't encourage is the women or couples that say, you see this person is taking this one have worked. You leave the one you're taking, you are running around, running helter-skelter. No, our body system differs. Your body system differs. What works for this person may not work for you. You have to follow your own treatment procedure. You have to follow it. You have to follow your treatment procedure. And you see it working. You see it working out. So it's a thing of both sides. It's a thing of both sides. And at the end, both of you will be happy. Both of you will rejoice about that result. What have happened? What have happened? Yes. So there is need for openness. There is need for oneness. There is need for openness. When you open up, even if you can hide anything from anybody, not your doctor, not your fertility counselor, because your solution is standing right there before you and you are hiding everything, how will you be saved? How will it work out? How? The person that will save you, the someone that will give you, that will help you. And finally, I want to also, and I said something like that yesterday. This treatment works in 2 ways. Physical and the spiritual aspect of it. Don't neglect spiritual aspect of it. Trusting in the Lord, believing in the Lord, telling the Lord what you need, how you want it. He knows your heart. He knows your problem. He knows how, he knows when. The word of God said that the Lord ordered the feet of the righteous. The righteous man. The Lord will order your steps to the right place to get the right results. There are some people that have gone around the world, still going, no results. And it's for those he loves, he can only show mercy. The feet of the righteous are ordered by the Lord. But when you are not commending your ways in the hand of God, you see yourself struggling. But But your solution is there and your eyes is not even open to see it. To see it. Somebody with meat, you just plug one leaf like that, boil it, and your womb, everything will open. That is why you need to commit in the house of the Lord. Anything you are doing, you keep on praying. Say, Father, even if it's not working for other people, use this man to settle my case. Use this man. Use doctors. We are all human. Bible said that human help is worthless. Yes. We are all human. But one understanding, one knowledge, God can help you. God can just help you. As a result of your faith in him. As a result of your trust in him. There is nothing impossible, even if they say it's not possible. There are women I've seen, they say not possible, no womb, confirmed, no womb. But today they're carrying their baby, not just one, oh, serially. God just mesmerized devil. Mesmerizing. I know a lady, she had multiple fibroid. On the process of the surgery, they removed her womb because the growth was much. The womb was removed. But if you see, today she has 4 kids. She keep on believing on God. Anytime if you go to scan, whenever she's pregnant, you see something like pouch holding the baby. Pouch. How did that pouch appear there? It's only God knows. He knows. He's the creator. He can replace. He can renew. He can change. He can kill. He can make. He can kill it and make it alive. It's only God that can do it. That is why you need to look up to him. Look up to him. As the psalmist said, I look up to the hill from where cometh my help. My help cometh from the Lord who made heaven and earth. Not from above, not from abroad, not from man, but my help cometh from the Lord who made heaven and earth. You need a positive mindset. You need it. You need it. Avoid depression, as I said yesterday. Avoid any form of discussion, any form of news that will make you to get depressed. Avoid it. Avoid it. It is possible. It's possible. Believe in yourself. Believe your wombs are open, your tubes are open. Nothing is holding you. No power can hold you down. Nothing, no way. You have been redeemed and sanctified by the blood of the Lamb. I am talking about Christians. Many people have different religion on what they believe on. Know what you believe on. Believe in that thing. Believe in it. Hold that thing strong. Believe it. Believe it. Have faith. Have faith. Make sure you are sacrificing. Yes. Sacrifice can break yokes, that thing that looks so impossible, see it happening, and people will be saying, how did it happen, how possible is this? It's only God knows when, how. Only him knows where you will go and get that result, but you need to get the right information. Make sure you are doing something as you're waiting on the Lord. Make sure you're doing something. Keep on doing something. Do something. Do it rightly. Do it. You know, when you have understanding of something, when you know, as in it's a knowing, you know it. The fact is 50-50. The solution is there. But when you are confused, you are just confused, walking from here to here. No, pointless, endless. You don't know even where you are going to. Commit it into the hands of God. Only him knows the way. As he said in the book of John 14, verse 6. He said, I am the way, the truth, and the life, the only way. Follow him. You will see your result coming up. You will see him changing your story. You will see him turning that situation around for your favor, for your good. You will see him doing more than you expect. If you have done it before, your own case cannot be different. Because the Bible says without faith, you cannot please God. In Hebrew 11:6, faith is what you need. If you see faith, where there is faith, there is urgency, there is attention of God there. But where there is no faith, no way. How can you please God? You can shout, you can cry, your tears may not move him. But your faith can move God. Your faith can move him. Your tears may not move him. Because if you have faith, You will not cry, because when you know that God is able, He have done it before, He will still do it again. He's the God today, yesterday, today, and forever. He's the same today, yesterday, today, and forever. You believe Him. You see it working. But when there is no faith, you feel biased, you feel discouraged. But believe in His almighty power to change your situation for better and for once. I want to sing one song before I round up this section. He has done it before. He will do it again. My Lord have done it before. He will do it again. He will do it again. He will do it again. He has done it before. He will do it again. He will do it again. And again and again. And again and again. And again and again. He has done it before. He can do it again. He has done it before. He will do it again. He will do it for you. He will do it for me. He will do it again. He will do it again. He will do it again. He can do it again. He can do it again. And again and again. Be positive about that challenge. He can do it again. He can do it. He can do it again. My Lord have done it before. He can do it again. He can do it again. Prayer without work is useless. Yes, that's why we are here. The working. We are here for the working. And you do the prayer. And you do the prayer, you see God changing situation around. You see God turning things around for your sake. You see Him doing wonders and miracles for you. You see Him changing situations for you. He has done it before. He has done it before. He has done it before. He can do it again. 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 He's a miracle God. 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 Alabayada. He's a miracle God. 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 God is a miracle God. Just believe Him. Just believe Him. With Him, all things are possible. All things are possible. I see God changing your situation. I see God turning things around for your sake. I see God changing that story, changing that mockery, silencing the mouth of your mockers. I see God doing it. I see God doing it for you. Just believe. Just believe. Consult us. We are here to schedule an appointment with you. If you have any challenge, you're having weak erection, endometriosis, fibroid, you are having blocked fallopian tube, you're having polycystic ovarian syndrome, any of them you're having weak erection, you're having premature ejaculation, any of them, we are here for you. We are here to counsel you, to give you the rightful information. So bring people you know that are passing through this challenge to like our page. Even if they're having cysts, any type of it, there are alternatives. There is a way out. There is a way out. So we are here for you. We are here for you. I really appreciate you all for being part of today's life. So as we are coming to an end to this section, we are going to have more time with people outside there because we have our patient waiting. So it's a privilege to have this wonderful time with you people, to share this knowledge with you people. So just give me 1 minute. I will come back as we round off this section. As we round off this section. No, no. Okay. So we are coming to an end to this live section. See you some other time tomorrow by this time, so that we can be able to attend to our clients up there that are waiting for us. So I'm so happy to have you today. See you some other time. See you some other times. Just stick to this channel. We have a lot of things for you. A lot. We have a lot of things. We have a lot of things for you. You will learn a lot. You will get your solution here. So for your passing through fertility issue, you will get your solution here. So thank you for being part of this family. Thank you for being with us. Thank you for watching. Thank you. Subsequent times we'll be doing giveaway. We help people, not just give away, but at least there are some people that don't have access. They may not have the money. We sponsor them. We sponsor them. We can, yes, we sponsor them to get their solution. So thank you so much. I really appreciate you all. Thank you. So have a blessed day. Have a blessed day. Have a wonderful day. Have a wonderful day. My lovely people, thank you so much.